Welcome to Dr. Balaga's podcast for the Curious Doc. Today is 23rd June 2026. This video is on a correspondence published yesterday, 22nd June, in Nature Medicine, titled A Case of Artificial Intelligence Enhanced Diagnostics Leading to Heart Transplantation. Structural heart disease remains underdiagnosed because echocardiography is a resource intensive and unevenly accessible. AI-enhanced EKG analysis offers scalable opportunistic screening. SAGE, or structural heart disease diagnosis using AI in the emergency department, evaluates AI-ECG guided screening for diagnosis and management. Methods. This was a sentinel clinical case embedded in the SAGE trial. The setting was the emergency department. 12-lead EKG was analyzed by EchoNext, a validated AI EKG model for structural heart disease. Workflow: a high-risk flag resulted in care coordination review and urgent outpatient echocardiography, which resulted in clinical escalation. The index patient was a 45-year-old man with shortness of breath, productive cough after wildfire smoke, 30 years smoking prior, and he had a history of prior TB. What did they find? Emergency department diagnosis was asthma, flare, chest X-ray was normal, and mild cardiac injury marker elevation. EchoNext flagged high risk for undiagnosed structural heart disease. The echocardiogram itself showed an LVEF of 10 to 15% plus severe mitral regurgitation. Genetics was done, and it was pathogenic LMNA variant linked to dilated cardiomyopathy and sudden cardiac death. The course was heart failure therapy, failed, temporary mechanical heart pump, and a successful heart transplantation 6 months after the diagnosis. The limitations of this report is a single case, no causal counterfactual, outcome dependent on research grade care coordination, not algorithm alone. The false positives and communication strategy remain unresolved. Generalizability, cost effectiveness, clinician uptake, and bias migration require prospective validation. Competing interests include algorithm inventorship and equity disclosures. Key takeaway: this is the first reported case of AI-detected advanced heart failure leading to orthotopic heart transplantation. AI-ECG can act as a safety net when symptoms mimic pulmonary disease. In SAGE, EchoNext produced over 200 new structural heart disease diagnoses missed by routine care. More than half the referred patients had disease. Positive predictive value was 55%. The diagnosis doubled while maintaining positivity higher than previously reported clinician-ordered first echocardiograms. Over 12 months, the care coordination team ordered more echocardiograms than any single provider across 10 hospitals and 200 clinics, with a 55% positivity. Clinical interpretation: this is less AI replaced the physician than AI rescued the signal. The electrocardiogram became a triage biomarker for hidden cardiomyopathy, but downstream human choreography made the transplant possible. Prior EchoNext cases can also included AI detected severe aortic stenosis leading to transthoracic aortic valve replacement, transcatheter aortic valve replacement (TAVRs), and severe MR leading to surgical repair. Future directions: integrated AI across ECG, echocardiogram, and multiomics for refined diagnosis and disease subphenotyping. Clinical pearls. Dyspnea is a shapeshifter. A normal chest X-ray and improvement after bronchodilator and steroids do not exclude occult heart failure, especially when electrocardiogram contains a buried cardiomyopathy signal. Second, AI is a safety net, not autopilot. EchoNext did not treat the patient, it triggered urgent echocardiography. The clinical value came from algorithmic detection plus accountable human follow through. Third, workflow is the therapy lane. The key intervention was not merely showing a risk score. A care coordination team converted an alert into an echocardiogram, admission, advanced heart failure evaluation, and transplant pathway. Genetics can shape an urgency. The pathogenic LMNA variant reframed the case as high-risk dilated cardiomyopathy with potential sudden cardiac death before the obvious clinical recognition. Positive predictive value matters. A 55% positive predictive value in the SAGE workflow suggests a clinically workable enrichment strategy for echocardiography, high enough to be useful but still requiring careful false positive counseling. Equity requires infrastructure. Opportunistic emergency department screening may reach patients with limited outpatient access, but benefit will depend on reliable follow-up, transplant communication, and biosurveillance. The bottom line, AI electrocardiogram screening may turn a routine emergency department tracing into a doorway for earlier structural heart disease detection, but only if the doorway has a staffed hallway behind it. This is an infographic on this article. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.